Ymedia Group, the fastest growing media group in North America.
Hello and welcome back to Ymedia Newsroom. I'm Runa Singh. And what is happening in Canada? Well, Canada has announced that it's going to invest $66 million in AI to build a sovereign compute power. Essentially, for AI specifically to that. This was announced yesterday by federal AI minister Evan Solomon, and he announced that there's going to be $66 million for 44 Canadian artificial intelligence projects, and this is through the first round of Canada's new AI Compute Access Fund. And this is an announcement that he made at the Web Summit in Vancouver. Essentially, this is a big deal because, of course, you can't ignore that there is an AI race, and Canada wants to be a part of that. And this is to be able to fund Canadian startups, small, medium-sized enterprises, and overcome what would be, the biggest barriers in AI. So that is access to computing power. This fund is going to help in training advanced AI systems that require expensive GPUs, massive data center infrastructures, cloud access, and high electricity usage. Ottawa is saying that their goal is to keep Canada's Canadian AI talent. We've seen the latest numbers of software engineers and coders essentially leaving Canada. And those are some big numbers that they're leaving for better opportunities elsewhere, because this is an AI race we're in, and they're going where the opportunities are. So this is part of an initiative to make sure that Canadian AI talent stays in Canada and is able to, propel this AI race and have those be part of Canadian companies, and make sure intellectual property stays here, and make sure there's infrastructure to be able to support it inside of Canada instead of relying heavily on US cloud giants, which, Amazon, ASW, or some of the other cloud giants so Canada, essentially, there's also the cybersecurity, national security. All of those are factors that Canada needs to invest more on its own infrastructure, and to be able to have the talent and the dollars to do that. So here are some of the key numbers for this program. There is $300 million available at the AI Compute Access Fund. Out of that $300 million, it was $66 million that Evan Solomon announced for 44 Canadian AI companies as the first allocation for those 44 projects. And the subsidies are about 67% of subsidies for companies using Canadian-owned data centers, and 50% subsidies go for non-Canadian compute. So this is a major for AI projects that need to be funded. To do some of these massive projects would be like, for example, wildfire detection, right? There's a company called SenseNet that uses AI systems to detect wildfires. Do you remember what happened in Alberta and in British Columbia? We see wildfires happen annually, and so this is one of the projects that would, have AI systems detect wildfire detections, monitor them, and create prevention, obviously, to be able to, implement strategies as a preventative model before the wildfires expand. And then you have the worsening wildfire seasons that come in Canada that affect the entire ecosystem. There's funding for a project called SPARE, which is a public transit optimization. In this, they're using AI to optimize public transit routing, reduce inefficiencies, and improve mobility systems. So this is what this money goes towards, these projects that essentially make these companies and what they're providing in the ecosystem more efficient to solve some of these problems, less rely on humans and human research on data and monitoring, and have AI be able to do that. And we've seen what AI can do within seconds. Then the funding is also going towards a project called Cancer Care, for the project of Gray Oncology Solutions. They're using AI to optimize cancer care resources when it comes to scheduling patients flow to make sure, no patient falls through the cracks and they're getting the care as needed. There's also funding that went to Fluid AI for clinical research. They're working with Hamilton Health Sciences to improve clinical research pipelines, healthcare efficiencies, diagnoses. Another one went to BC Receive Major Shares, and what they're doing there is, they got this project received about $16.8 million across 8 initiatives when it comes to Vancouver as one of the fastest growing AI hubs. And so this is where the money's going in case, these are taxpayer dollars, right? This $300 million fund is tax dollars, and that's why it's important to know what's the transparency of where these dollars are going, and these 44 projects that got the initial $66 million by Minister Solomon. What are they working on? And how does that impact the economy, the community, in greater sense? So these are, Ottawa is signaling that, they need to have an AI sovereign compute strategy because their concerns have been, AI researchers, and they've noticed that, even though Canada does have strong AI researchers, it lacks enough domestic compute infrastructure, GPU capacity, and hyperscale AI centers. And so we're going to see what this means for, the $300 million, and will this attract also private funding that would come into place and perhaps show Canadian companies that, they should invest in some of these key components and build out some of this infrastructure when it comes to, for AI. And also what matters is, if Canada wants to be more independent from US cloud companies or foreign infrastructure or external capital, it's putting up taxpayer dollars. And, there's critics for that. But then, of course, we're in this AI race that it's very hard to ignore, what is the AI strategy, because other countries are just racing ahead. Now, when it comes to this AI infrastructure, this is part of the strategic national infrastructure, right? Because it comes to what this AI infrastructure would be. It would be very similar to, energy infrastructure or telecoms or defense or semiconductors. And this is why this global AI race is now becoming what is now a compute race or an electricity race or a data center race. And we saw the latest numbers come out from U.S. data centers are using 6% of the electricity grid. And we know this summit taking place in China between U.S. and China, we know that this is part of the bigger conversation because everyone's looking ahead at what is going to drive growth in the future. And there's no way you can opt out of it because every other country and the companies within those countries are racing ahead. And to that, we have news when it comes to the First Nations leaders. Well, they had a press conference yesterday, and they're saying that they're demanding reform to Indian Act. They're saying that this controversial second generation cutoff rule is something that they're going to be pushing forward to. They're calling it discriminatory, and they're warning that it threatens long-term survival of Indigenous communities. And they're saying that essentially, this is part of Canadian history, and Canada just can't go ahead and not reform the Indian Act. Essentially, here's what's at the part of this entire thing is that the First Nation leaders are demanding to end the Indian Act, second generation cutoff part of it. They are saying that they want to advocate and demand Ottawa to immediately repeal what they say is discriminatory in this sense when it comes to the Indian Act, second generation cutoff. Second generation is obviously the generation that comes after in Indigenous communities. They're calling, they're saying that this is coming from criticism also from other organizations such as the United Nations Human Rights Committee. They're also urging Canada to eliminate this ongoing sex-based discrimination in status when it comes to the Indigenous community. So what is the second generation cutoff? Essentially, this rule, it limits how Indigenous status can be passed down to descendants. So, I actually have had a few Indigenous friends, and they have this like ID card, it's their Indigenous card, which they use and they identify, and therefore they're exempt from, certain taxes and certain things. And so this rule would come into effect to say that this Indigenous status cannot be passed down to their descendants. And critics are saying that this system results in what would be loss of legal status, reduced rights for second generation Indigenous communities. And it would be an exclusion from certain communities, and eventually this is going to be a legislation, like the law would be extinct if this comes into effect. So yesterday there was a roundtable that was held to be able to talk about some of these issues that the Indigenous community is going through, and really highlighting, where they stand. And, there's been so much that's happened with Indigenous communities. If you recall, the missing and murdered Indigenous women, about 2,000 cases just unsolved. So this is part of the other items that are, piling on in terms of what the Indigenous rights are in Canada, and what that means. But advocates of this entire thing, they want Canada to adopt a one-parent rule. What they're saying is this is similar to a Canadian citizenship transmission standards. What they're saying, they're arguing that the constitutional rights cannot be delayed indefinitely when it comes to these consultation processes for the second generation of Indigenous communities. So big, when it comes on Indigenous rights, constitutional equality, and of course, some of these legislations that were passed. And very important times, of course, we're seeing that play out in the courts in Alberta as well, which is actually delaying the process of the petitions for a referendum to separate. So that's some of those things are taking place. And of course, we're going to bring you the latest of what's happening with the Indigenous communities and how it impacts some of these laws and how it's impacting them, and what that means, on the greater impact for Canada. What's also happening now is that Ontario has now passed expanding authority for pharmacists. They're essentially saying that they want to be able to create an environment where if you're a patient and you need your prescription medication renewed, that you can essentially go to your pharmacist. There's still a backlog of 1 million Ontarians that don't have a doctor, and so therefore for them it's very hard to get their prescriptions renewed. So this is an effort for Ontario, the government essentially expanding the authority of pharmacists, which will allow them to prescribe medication for more conditions and renew the broader range of prescriptions as Canadians that don't have doctors, or Ontarians that don't have doctors, essentially cannot get these prescriptions. So now this is moving in aimed at like reducing pressure on family doctors. So the ones that do have family doctors and need to book appointments just to get a prescription or their prescription renewed, this is supposed to alleviate that, but also create shorter wait times, and also give access to people who do not have healthcare, access to doctors and healthcare services. So what's changing is Ontario's pharmacists are already, they already have the authority to prescribe minor ailments, basic infections, allergies, and some skin conditions. And now the province is moving forward and expanding that to prescribing authority. So medication renewals, chronic condition management, and frontline healthcare responsibilities, which will, fall on the pharmacist. Now, these changes are strategic because some of the things I mentioned was doctor shortages, ER overcrowding, right? So if you don't have a family doctor, you're going to go to the emergency room at the hospital to get some of these checkups and to be able to get the prescriptions in place. And then, we've seen that there's overcrowding, and emergency rooms, and then you have people who actually do have emergencies that are life-threatening. There's the backlogs. Like we've heard in Ontario, hallway healthcare, right? We've heard this as a slogan during election time, and this is supposed to be able to have people go less to the emergency room and go to their pharmacist because they don't have a doctor. Yeah. When you think about that, it's like, just the fact that, in Ontario you have OHIP and you should be able to go get health care, and, lack thereof, not having a family doctor, then you're going to your local pharmacist. And the question remains is the now that the pharmacist is going to have more authority to do some of this frontline work and to do the prescriptions, the question remains, is the pharmacist qualified to do that? Like, do they need to upgrade some of their certification qualifications to be able to, take these new powers? And if so, how do you risk there not to be any sort of, issues with that, right? Like, we don't want future scandals for prescriptions being signed and renewed when it doesn't need to be. So this is all part of, like, what's the oversight, right? With new powers, you need to have new measures of oversight. And of course, it's understandable as a short-term solution for doctor shortages and ER overcrowding happened because of doctor shortages, right? And gaps in primary care. So the province essentially needs to address doctor shortages and advancing more doctors in Ontario and having Ontarians have access to doctors. And these are other short-term solutions, which is these new powers for pharmacists. So, the million Ontarians without a family doctor, and then there's the long walk-in clinic wait times, right? So if somebody doesn't have a family doctor that going to a family practice, then they go to walk-in clinics, and then if not walk-in clinics, they're going to emergency rooms, and then that creates, of course, the backlogs and long waits. So this is part of that, and of course, there's the growing healthcare demands of the aging population. That's of a concern, and so pharmacists are now being tapped to take care of some of these things. So now most Ontarians can access, some of these measures with their pharmacist to get their prescriptions renewed and not have to go through appointments and these long wait lines. Ontario is talking about when it comes to AI, it wants to also expand in AI tools and digital healthcare systems, and administrative automation is part of this healthcare vision that Ontario has. So essentially, Ontario's Auditor General recently warned that some AI systems used by doctors are saying that essentially they are sometimes fabricating information or suggesting treatments never discussed with patients. And we've seen that, right? Like, anyone who's used, for example, ChatGPT or any AI tools, from like 2023 to now, a lot has changed, but you still have to catch it when it's giving you false information, right? Because essentially when you catch it on its false information, it says, oh, I'm sorry. Yes, you're right. And then it takes that information and then it spits out more information. So this is what the Ontario's Auditor General has found, is that, doctors who are heavily relying on AI is still young. It's still new. Even though the advancements have been incredible in such a short period of time, you still need oversight in terms of what is the AI coming up with when it comes to diagnosis, what it's coming up with in terms of, information and treatment. So this is part of, even though, yes, the healthcare system needs to modernize and go into this AI age, it still needs to have oversight on patient safety and at the same time, patient safety with healthcare modernization. So very important things. Supporters are, of course, for this, because they're saying it's going to improve access and reduce ER waits. But then, of course, you have critics that worry about fragmented care. You go to your family doctor for this, You go to, the pharmacist for that. Is there going to be a fragment of what the pharmacist is saying compared to what your family doctor is saying? And if you don't have a family doctor, then you're relying on the pharmacist. So this is all new stuff. Of course, we're going to see how this rolls out and how it goes. When it comes to the healthcare system, it is globally shifting towards decentralized care, right? We've seen appointments on the phone. We've seen now video appointments. We've seen before with certain, approved drugs by the FDA. First you had to go get, it from your doctor, and now it's if you qualify from any doctor, on a video visit. So we've seen this nurse practitioners taking a bigger role in all of this, and now it's pharmacist. Telemedicine has now been around for the last few years, and I think the uptick took during COVID, right? When you had to distance and you couldn't go into, the clinic or the ER, and you had to, really try to get a doctor on the phone and for them to diagnose you. So then we've seen, this digital transformation of the healthcare industry, and now AI is just another step to all of that. Final thing is that Artemis 2 astronauts are here in Canada, and more specifically in Ottawa, meeting with the Prime Minister just a few hours ago. Essentially, this is big news. We have a video from the Prime Minister from his office with the astronauts. Of course, as a part of the astronauts of Artemis 2, there was a Canadian astronaut, which you'll see in this video. Essentially, the Canadian astronauts, Jeremy Henson, made history as the first Canadian and the first non-American to the moon as the mission broke Apollo era distance records and marked a major milestone in NASA's Artemis program. Here, I'll have you listen.
L'équipe d'Artemis, y compris Jeremy Henson. It is such an honor on behalf of all Canadians to welcome the team of Artemis. We followed every move that you made. Jenny, thank you as Capcom for keeping them on schedule and bringing them back home. Jeremy mentioned in one of his comments, and I mentioned, this is the first time we've actually had a conversation on Earth, actually. But he mentioned in one of his comments that this mission, which involves some risk, hadn't been done. This is as far as any people had gone into space, but it was risk for a reason, and risk to set up even bigger opportunities. So we're going to have a chance to talk about that, talk about what Canada can do to help contribute to that. But it's a big, big lesson, I think, for all Canadians of what teamwork does, what dedication does, what courage does, what human ingenuity is capable of, and that it's just the beginning. So welcome to Ottawa, and thank you for what you've already done. Thank you for inspiring us all. Thank you, Jeremy.
Thank you, sir. Quelle honneur pour...
There you have it. Artemis 2 returned to Canada for the first time since completing their mission to the moon in over 50 years, and they presented Prime Minister Carney a plaque with the Canadian flag that was taken to the moon, so it's very special. And then the Prime Minister presented them with a medal as a remembrance. So great time, and of course this is great to see for a Canadian astronaut that went to the moon and back. That's all the time we have. This is the newsroom. I'm Ramona saying until tomorrow, take care and be well.